My name is Dr. Cheryl Burdette, and I am the clinical director for Origins Incubator. And this week in our case studies, we had a really interesting conversation. We talked about a patient who was presenting with secondary hypothyroidism. So rather than the traditional high TSH and then low T3 and T4, what we were seeing was a lower TSH, but yet still low thyroid hormones. So we examined some of the reasons that can be true. And we talked about how even things like lipopolysaccharides can cause a block between the communication of the feedback of thyroid hormone to the TSH. And so you can see a euthyroid or this sick thyroid type of presentation from gut-based dysbiosis. However, another reason you can see that is because of cortisol. And so we talked about the stress implications, particularly for this patient. And as we unraveled that, what we learned about the patient is that, in fact, probably more the heart of her issue was this stress-based background. A lot of trauma, many things had happened, struggles in her life, and she began to shed tears when it was brought up. But then she began to build walls. And as the practitioner began to suggest this might be really the crux of what's going on, she said, nope, I'm only here for thyroid, and I'm not going to think about anything that's going to help me to address the stress itself. So the practitioner felt very limited, felt that we can't put our best foot forward if the key thing that's going on is stress response and the patient is unwilling to deal with that. How do we feel about accepting somebody like this into a membership-based practice? And so we also talked about boundaries. How do we work with somebody like this? And one of our collaborators, she said, you know, a good idea would be to say, we're going to do a temporary program. It's going to be stress-based, and then we're going to remeasure some of these thyroid parameters and see how much they respond to stress. And so we talked about how what fundamentally had to happen here is education. And the patient has to know that in our clinical opinion, the primary thing is the stress response. It's likely creating cortisol that's causing a miscommunication between the thyroid feedback and the pituitary. And without addressing that underlying issue, we can't expect that the patient will have the fullest outcomes. And just educating and being honest, and then both of us deciding from there, both the patient and the physician, where we want our next moves to be in terms of how that relationship will go forward. And these are hard topics, but they're appropriate topics. We need to decide if somebody is the right fit for us, because if we feel that we're limited in giving the therapy that we need to give, that well may not be a relationship to enter into. So this week's case conversation was a perfect example of the realization that managing patients is more than tweaking the thyroid and adding in some supportive nutrition. That is a great first start, but it's also how they enter into the relationship and where we're going to take it from there. So we tackle these harder issues at Origins, and I think this is some of the real value of that community coming together, just saying, hey, what would you guys be doing? Take care.